The role currently for margetuximab for gastric and esophageal cancer is investigational at the moment. Margetuximab is an antibody that essentially is like a trastuzumab Herceptin super antibody that's been optimized, an Fc domain component of that antibody to enhance an ADCC response, an antibody-dependent cell-mediated cytotoxicity. So natural killer cells, NK cells, bind to the back of antibodies and enhance an immune response once the antibody binds to HER2 on the tumor cell. In the population, there are different groups of people that have different affinities of this binding of the NK cell to the antibody. And so only about 15% of people have that affinity that's really high. The other 85% have a sort of weak affinity of NK cell binding to Herceptin. So the margetuximab molecule is trying to enhance that ability for the other 85% to have a strong affinity for the NK cell. So that's what the drug is. And so far it's been investigated in the second-line setting of gastroesophageal cancer, and that data has been reported over the last few years in the most recent updated survival data at the last meeting at ESMO. And it's very promising data, particularly in patients who are HER2 amplified at high levels that is persistent at the time of starting second-line therapy, because some patients become HER2 negative after first-line failure. And so, of course, you would expect they should still be HER2 amplified tumor cells to have any benefit. So that was one. And then two, because we had combined margetuximab plus pembrolizumab, an anti-PD-1 therapy checkpoint inhibitor, patients who had CPS PD-L1 1 or higher, though double positive, high HER2 and PD-L1 positive, those patients had really remarkable outcomes in second line. So based on that evidence and data, the current status is that it's being moved into the first line setting as a study called the Mahogany study, and that is ongoing now already. It is a little bit of a complicated study, but essentially there's two main components. One component is essentially a chemo-free arm of just margetuximab plus a different PD-1 inhibitor, an internal antibody at the same company, combined, no chemotherapy, in newly diagnosed patients with high HER2 levels and PD-L1 CPS 1 or higher. And it's a single-arm study, open label, no randomization. And the idea there is that if response rates are obtained that are considered very favorable, that this might lead to an accelerated approval of that pathway. Then the second component of that study is a traditional sort of phase 2-3 study of all HER2 therapy patients, irrespective of PD-L1 status. And it's a randomized study with a control arm of a chemo plus trastuzumab, and then there's a chemo plus margetuximab arm, and then a chemo plus margetuximab plus an anti-PD-1 inhibitor, and sort of pick your winner to go on to a phase 3 strategy. So that's a longer term project. So that's the status of margetuximab in this disease.